speak now to Anna Hansell, who is a professor of environmental epidemiology at the University of Leicester. She joins me now from London. Thanks so much for speaking to us. Okay, I'm a bit baffled by this research, actually, because if air pollution exacerbates, COVID-19, then New Delhi should really be suffering worse than, anywhere on the planet. Yet the cases there remain relatively low by comparison.
The really important thing about the pandemic is that you have to be in proximity to someone with the virus or pick it up from a surface or possibly through the air. So I think that's really important to keep in mind. What scientists are concerned about is that once you've had that potential for infection, is the exposure to the virus plus the air pollution together going to mean that you're more at risk of a severe case or more likely to die from the infection. And it's quite difficult at this stage to compare different countries because we're all in different stages of the pandemic. So the countries that went first, we're learning lots of things. We've only been going 4 to 5 months. That's a really small period of time to be doing the type of health analyses that we're doing. And this paper that came out from the States is a really nice paper, but it's one of the first papers to look at this in detail. And I think there's a lot more work that we need to do to try and unpick what's really going on here.
Yeah, I agree. I mean, there are some real anomalies in COVID-19. I mean, first the fact, for example, the simplest one, that children who often have weaker, less developed immune systems are not suffering, the bulk of infections by any means. In fact, they're in the vast minority. And now there's a study in France actually looking at whether smokers seem to be less affected by COVID-19. It's so hard to figure out where this virus really strikes hardest.
I totally agree. I'm finding the epidemiology really fascinating. I started off life as a respiratory doctor, and then I moved into public health and epidemiology to try and stop people going into hospital. So I think there's some really interesting clues in this. The children, I think we don't fully understand why they're much less affected, but it's great that they're not. The thing about the smokers is more complicated. So the initial study suggested if you were a smoker and already had some chronic heart and lung damage from that, you were more at risk at dying from COVID-19. And the more recent studies are suggesting that smokers are underrepresented in patients who come into hospital. So there's lots of possible reasons for that. One of them is maybe you die at home before you get into hospital. But another possible reason is related to the nicotine. And there are some theories that it might affect the receptors in the lung that the virus attaches to get into the body, and actually makes it harder for the virus to get into the body. But again, it's really early days, and there's no way that any respiratory doctor would tell you that you should smoke to stop getting the virus, because there's so many other adverse health effects from smoking.
Okay, Anna Hansell, unfortunately, we're going to have to leave it there. Thanks so much, though, for sharing your insight. We greatly appreciate it.